I came into this as an implant patient off some failed dental work, and my family has been, and you and I have discussed this, that because our niche was dental implants and the All-On-X procedure when we were marketing for these dentists, those kind of patients are even more so. You take 100 of them, how many of those are going to have, whether it's justified or not in their own mind, which is reality, perception is reality, especially for that, they kind of come in a little aggressive, like I did, and that's what's helped us be so effective in this, because we knew how to communicate that story. But how do you, how did you transition and really learn and almost grow a compassion for dentists? I mean, I hear it, and I'm almost envious of it because I'm working on it. I'm just not there yet. So tell me and that's a good point, that it is a hard job. It is not easy. I mean, you're dealing in people's mouths, and I mean, I wouldn't want to do it.
So I think two parts of that. One, as I mentioned, I'm a patient first, right? It's the patient experience. That's what we work on. That's what we teach. But more importantly, I'm a patient. I mean, I've been in the chair probably more than 99% of America. So I'm a product of the product. I've had more dental work done myself than 99% of America. Dentistry's changed my life. Literally changed my life. And so my passion to help practices and format them in a way that they can do that for more people. Yeah, I'm all in on this. So I've had the personal experience. I know what it can do for people, and helping practices structure themselves in such a way so they can do more of that for other people. That's what I'm all about.
How did it change your life?
In my particular case, I had a rare genetic airway obstruction. I couldn't breathe, but I didn't know I couldn't breathe. So my air intake was very, very abnormal and very low. It took decades to figure that out. And it was a very astute dentist who diagnosed it, laid out, set the whole table for me, and explained what the long-term consequences of that were, and laid out a treatment plan that made it very, very easy to say yes, and did the multiple procedures that it took to correct that genetic airway problem. And I can breathe today. And I got a pretty decent smile out of the deal too.
Yeah.
So yeah, it changed my life.
So you really have, you've had a different kind of life change experience with the dentist. I mean, they literally, it's not elective in your situation. It was.
I did have a choice to make.
Well, sure.
It was a
I guess
necessary
open heart
choice,
surgery
right?
is elective,
Right. But it was a necessary choice.
And so that helped you. Okay, that's
changed my life.
Yeah,
in more ways than one.
And it gave you a new heart for dentists and what they can really do.
100%.
That's good. You're gonna help balance me out. I appreciate that. Seriously. And the life change side of dentistry, that is what has been time and time and time again on all these interviews I've done, not just for this documentary, but for, all the different clinics I've worked for. They'll send me patients, I'll go interview them. And there is a common theme of the power of a smile and how it can change. And I tell these dentists and these clinicians, the power that dentists hold is huge. I mean, it really is. And so that's what I got so excited in hearing your presentation and getting to know what you're doing, multifaceted, but especially through TOPS, when, seeing that you're trying to make, you really are enhancing the patient experience and making that clinic a better clinic. It's not just a living for you. I mean, I saw the passion side, which I now understand more clearly.